back, you guys. You guys have not seen this face in a while, so or at least not seen me lecture for a while. So we're just going to go ahead and go right into the presentation. I got my timer set for 20 minutes. Let's go. All right, so chapter 6 is basically your pre-participation physical exam. Now, these notes are in your Blackboard, just FYI. A few things about your pre-participation physical exam. It's mandatory if you plan on playing a sport, either on the college level, high school level, middle school level, elementary school level, whatever level it might be, even for a 5-year-old, it's mandatory. It goes a little deeper in terms of when you go into middle school, high school, and college sports and professional sports. But of course, every person has to be cleared for physical activity, and is done so through an examination. Okay. It's essential for all athletes. Every college I've worked with or worked within as a student, as a professional, it was mandatory no matter what. They all had to come in, or they didn't suit up. They didn't sit. They didn't play. It was mandatory. So it does occur before participation, as I mentioned, that oftentimes if this isn't done before the season starts, or if it isn't done before the first game, then the athlete is just not playing. Some locations won't even let you practice. So just depends. So oftentimes it is performed by a medical doctor, a physician. A nurse practitioner can do a pre-participation physical. However, it must be signed off by a medical doctor, physician. Okay. There are stations to it. There's levels to it. They just make sure that the physician or the doctor or the nurse practitioner make sure that you are covered head to toe in terms of a pre-participation examination. So a more sophisticated examination will have every athlete rotate station to station to station to station. Sometimes, athlete just might kind of go in one place and got to go to another place and got to go to another place and take the same paperwork. I've seen both, where an athlete was able to go to different stations, and an athlete had to go to every doctor in their city to be cleared to participate in the sport. Okay, this is an important piece. Be mindful. This is a just question. So, table 6.1, and this is also found in your book. This identifies each station and the individual responsible for conducting the task in that station. As you can see, towards the end, the physician analyzes the ear, nose, throat, heart, lungs, abdomen, and clears if the athlete is able to participate in a sport. But there are oftentimes other locations where an athletic trainer can participate in the pre-participation physical examination. Say that 3 times fast. And you're going to have parts where a student assistant can involve, maybe an intern. If you're interested in seeking your master's degree, this is a good opportunity to kind of get your feet wet and understanding as far as the medical needs of an athlete. I do have friends that are physical therapists now, but they did their share of internship work in terms of working with athletes. Now you'll notice that the only place where you'll see a strength and conditioning coach is during the fitness testing. So it's important to know which area and who does what in which area. As I said, sometimes you'll have people doing double duty. It really isn't advised for people to do double duty, but I mean, what can you say? Sometimes you might see the athletic trainer doing the registration work. Just totally depends. Okay. Of course, it measures height and weight. And of course, it goes over BMI, which is on a chart, which we'll go over in the next slide. It takes Skinfold, which has, I've included some links in terms of what your Skinfold is. I do encourage you, let me get my notes just so I can keep on track and stay under 20 minutes. Make sure you check out the RX website that I've included in your Blackboard course shell that talks about BMI and Skinfold. Okay. Most gyms, when they try to get you in and out, they'll do 3 sites. Some places use 5. You might see 5 or 7 or 3. Either way, what it does, it just measures body fat percentage among different places along the body. Click on that link and take a look, because that is possibly a test question. So not only from PowerPoint, but also from that website as far as locations for Skinfold. So play around with that website, get your research on, and just kind of go through it. You'll find that website is very useful. We talked about BMI. Also, what I've incorporated on in your Blackboard course shell is a BMI calculator. Now, BMI might have altered a little bit now that we have to consider obese and morbidly obese. More obese is, something that's been there for a while, but I believe morbidly obese was recently added. So definitely take a look at the BMI calculator on the EXRX website that I provided for you. All right, so you have 3 different types of body types. You have your ectomorph. Someone with low fat content might be slim, slight body build, mesomorph, low fat content, and a muscular build. I kind of consider myself to be a mesomorph because I'm kind of tall. Then you have an endomorph, who is high fat content with a stocky build. Someone who, when you think of stocky, you think of someone who might be kind of rounded at the top, someone who has generally a taller build. So again, find that on EXRX website, just to, because there's often different types of exercises that strength and conditioning coaches could benefit from in terms of knowing the body type of the athlete. And also another important aspect of this body type is to calculate BMI. So there has been research that has refuted BMI, because BMI is now let me make the record straight. BMI is your standard across the board to determine as far as just body makeup, body fat percentage. However, when I was in school 15 years ago, my very white, short professor / advisor at the time from Wisconsin, who graduated from the school up the road, said himself that the BMI chart is a little bit skewed, where it's really just highlighting your much younger, much elite, much slimmer white male. And he confirmed, he said it doesn't account for any African American whatsoever. It doesn't account for any bodybuilder whatsoever. It just kind of just tells you that, hey, you have too much fat on you based off of this type. So it's just something to always consider and think about. I will tell you a personal story. I went and had a physical, and the lady did my BMI, and she told me I was at 32. And I'm thinking, oh gosh, she's going to lecture me. And she said, if you're happy, I'm happy. I could care less about your BMI. And so, she said I was in perfect health. So that kind of tells you how the BMI changes. So I just want you to think to yourself, think about how the BMI said one thing, but you're feeling good, feeling great, feeling healthy, and your blood work is a reflection of your health. So things that make you go, All right. So, of course, naturally, what do you do when you go to the doctor to be seen? Blood pressure is taken. Norm is 120/80. And without me trying to pronounce that, because I pronounce it terribly, you do have the blood pressure cuff along with a stethoscope that takes your blood pressure, or most places are going automated now simply because we're in the middle of a pandemic. So for the most part, your blood pressure is going to be taken the first couple of minutes once you come into the door. Okay. They also take your pulse. We talked about radial and carotid. Let me know where radial or carotid is. Radial, carotid. Okay. Just to kind of assess just pulse, the strength of the heart, strength of the vessels, that type of thing. All right. Does take your respiration rate, takes your body temperature rate. Now, this is probably a golden piece of information considering we're in a pandemic. Places are taking temperatures. All right. So, average adult, no matter what, 98.6. Your temperature can vary. Some people are kind of leery when it's in the 99 mark. Some people are really leery. Actually, if it's definitely if it's 100, you're not feeling well. But some people are 99 only because, they've worked out. Your temperature is going to go up. That's natural. But when it's in the 100 range, yes, there's illness present. So, but general rule of thumb, 98.6 average adult temperature. Okay. We like vision tests, right? We like going to the doctor and then we like putting our hand on one eye and then putting our hand on another eye and trying to figure out what's normal vision. What is considered 20/20 vision. So you're just going to go over that chart. Now, in my experience, I've seen nurse practitioners do this chart or do this vision test. Or I've actually seen a CNA do it. So, it's just standard, how far the athlete can see and what the athlete can see. Chart really does the work. Also, another aspect to your pre-participation examination, your strength and conditioning coach, sometimes your nurse practitioner, well, not your nurse, but rather your nurse practitioner will be there to assess joint range of motion. This is important. That also tells on you whether there's an injury present or if there's maybe any inflammation or any swelling, that type of thing. There is a chart that goes over and navigates through important joints in terms of assessment of range of motion. Okay. Fitness testing. We talked about the strength and conditioning coach is the primary personnel for this specific task. And sometimes, and I have seen that the individual or a student who might need a fitness test, they'll go to a fitness center and maybe work with a personal trainer. But of course, most places are going to have a strength and conditioning coach. And this is just a list of the testing procedures that are done to determine fitness ability. So I gave you that link to EXRX. Please use it. It has so much good information about fitness testing. I think you guys will enjoy it. All right. So, postural alignment. Okay. This is another important aspect of it, and I've included that as well. Your plumb line are basically kind of the midsection of the body. Your strength and conditioning coach can sometimes do it. Nurse practitioner can do it. Medical doctor or physician can do it. It's just basically assessing posture from the anterior, the posterior, and the lateral or sagittal, if I could talk, sagittal view. So it just basically just checks for postural alignment. Maybe there may need to be a follow-up with a physician, maybe a follow-up with a physical therapist, that type of ordeal. So that's really the purpose of a posture alignment check. Ooh, mouth is dry. All right, ear, nose, and throat assessment. Of course, right now for this, the only person that can do that is a physician. As I said, sometimes a nurse practitioner can stand in the gap and review this information as well. But of course, with nurse practitioners, it does have to be signed off by a physician, okay? But as standard protocol is always performed by a physician. Just like the check with the heart and lungs can be performed by a physician, but also a nurse practitioner can do it. And you're probably wondering, like, nurse practitioner. There are nurse practitioners that do have a master's degree in advanced. They are considered an advanced practice registered nurse. And they do have the credentials to sit for an examination that calls them a nurse practitioner. They can virtually do everything or almost everything a doctor can do. And of course, there are some exceptions. And of course, they can't sign off on certain paperwork. Of course, certain labs won't go through. Of course, they can't conduct surgery, but they can diagnose and they can prescribe. That's what that is. So nurse practitioners can conduct that too. So oftentimes you're probably looking and like, oh my gosh, who's going to do this exam? It's only a bunch of nurses here. As long as you have an advanced practice, APRN, advanced practice registered nurse who does have the credentials as a certified family nurse practitioner. And depending on the age, sometimes it could be a pediatric nurse practitioner that can conduct a pre-participation examination. Because they basically can do everything with the exception of surgery and order certain labs. Of course, as a physician, labs move quicker, surgery can occur, and no problems with and no problems with prescription and diagnosis. So, and you do have a neurological assessment just to test us to look for any concussion, especially in the past, and then just to assess sensation, if someone can touch, feel, smell, that type of thing. Of course, that's important. They need to know when to determine pain, because if they don't have, if they can't really feel a lot of pain, or if it maybe is a different kind of sensation, then that can indicate some nerve damage. All right, final protocol. Like I said earlier, that even though a nurse practitioner can do a pre-participation examination as a whole, the physician has to sign off on it. And so that can sometimes delay the process. So that's why ultimately people just go to the physician. They just knock it out all the way. But if you do need an examination done, a nurse practitioner can do it. So they just basically go over the whole exam and they check off on everything. And based off of the assessment from the different stations that they went through, they determine, they're the final determination if this participant can play. So important factor here. And in summary, this is a critical process. All right. Critical process. As I said, nurse practitioners can do it. Larger locations, I would say probably like your University of Kentucky's, your University of Louisville's, your UNC's, your Auburns of the game. They probably do have a team physician. But of course, maybe if you are at a Eastern Kentucky, or I'll say my school, Winston-Salem State, nothing wrong with going to a nurse practitioner, especially a nurse practitioner who can get the job done. So if you have any questions for me, let me know. I'll chat soon. Peace.